Okay, welcome, Abhidha.
Hi, Abhidha.
I, I know you are very busy. Nice to see you here. Uh, Today, Abhidha will talk about the white matter thorax, and he's one of the most expert one in the world. Please, Abhidha, we are waiting for your presentation.
Thank you, Abhidha, and nice to see you. Hi, Ahmed.
How are you, Abhidha?
Okay, I'm good. So, Dr. Barash has shown us the anatomy of the central core of the brain. So, he's basically shown some good fibers also, and he's also showed a lot of the central core and the gray matter. So, what we are going to do is study all the fibers that are around this gray matter and how this architecture of the white fibers is there in the brain. So this is a specimen of the brain that we are very used to this view where you see the pia arachnoid, you see the veins, you see the arteries, you see the skull base. What we are not familiar is with this anatomy, the anatomy of this intrinsic brain. And it has been neglected for many years, but now because of a lot of information that we've received, everyone is now interested in white fiber anatomy. So let us start with this. Why is this change happened? So now people realize that it is not just the cortical area that is important. The white fibers that connect the cortical areas are equally important. So the human neural network consists of nodes, which are cortical areas, connected by a series of edges or links, which is the subcortical network, and it creates a fascinating grid of motor, sensory, autonomic, and emotional function. So everything is hodotopic. So both the cortex and the subcortical network is important for function. Earlier, we used to view these areas only as Brodmann's areas. We had 50 areas which were eloquent. Then we started looking at the myeloarchitecture. And now we are looking at functional connectivity and resting state networks. Basically, what this means is that we are seeing at the areas which fire when there is a particular function is being performed. So both the cortical and the subcortical areas that work together when you have to perform a function. And based on this, 7 major networks have been identified. And of course, there are many other networks. So these are the 7 networks. And also I will add language to this. So let's quickly look at the networks. So this is how we are looking at the function of the brain of both the cortex and the subcortical network. So this is the default mode network. And the cortical structures involved are the anterior and posterior cingulate, the lateral parietal clusters, and the white fiber that is responsible for this network is the cingulum, which you see here on the medial aspect of the hemisphere. Then you have the central executive network, which consists of the lateral frontal regions here, the posterior part of the dorsolateral prefrontal cortex, and the supramarginal gyrus. And the fiber system that works in tandem with this is the superior longitudinal fasciculus. The salience network, the fiber system involved is the frontal aslant tract, and the cortical structures are the anterior part of the insula, the operculum, and the middle cingulate, and the dorsolateral prefrontal clusters. So when a particular function is being performed or it's not being performed, these are the areas that come into play when that function is needed. So we are all familiar with the sensory motor network. So the motor is just not the motor cortex. It consists of the primary and motor sensory and cortices, the cingulate gyrus, the premotor cortex, the SMA region, and the pre-SMA region. All of these are important for performing the motor function and to execute a motor activity. And the fibers, of course, we are all aware of is the corticospinal tract. Now, the limbic system is another big network system. There are 4 or 5 limbic circuits, and this one is the one that we are very familiar with, and this is the Pape's circuit. And I will show you in the later dissections how we are dissecting this Pape's circuit. The attention network consists of the frontal eye fields, which lie in this region, and the structure that is involved is the superior longitudinal fasciculus, which connects it posteriorly to the visual cortex. Then the visual network has ventral, dorsal, lateral, and medial streams connected here by these optic radiations. The language, there are 2 main pathways. So the ventral pathway, whose main fiber bundle is the IFOF, which you can see in this image here. And indirectly, of course, the uncinate and the ILF are involved. The substrates, cortical substrates, are the superior and middle temporal gyrus, the dorsolateral prefrontal cortex, and the superior temporal sulcus. Now, if you damage this network on the dominant side, you will get semantic paraphasias. On the non-dominant side, you will get non-verbal comprehension disorders. Similarly, there's a phonologic pathway whose main pathway is fiber is the arcuate fasciculus, and also the indirect part, which is consisting of the SLF3. And the cortices is the inferior and middle frontal gyrus along with the superior temporal gyrus. So this is how the cortex and the subcortical network are functioning together to perform a certain activity. Now, before we delve into the subcortical network, let me just show you some beautiful images of some important eloquent areas as we see them. So this is the inferior frontal gyrus. This is the pars orbitalis. This is the pars triangularis, which is pulled up into the Sylvian fissure. This is the anterior Sylvian point, and this is the pars opercularis. Now, both the pars triangularis and the pars opercularis form the traditional Broca's area. But if you realize that the speech arrest does not occur if you stimulate here, it will occur in this area. This is the ventral premotor area. That is the part of the pars opercularis which connects to the subcentral, to the precentral gyrus by this connection that you can see here. This yellow circle you see here is the posterior and medial part of the superior frontal gyrus. This is the SMA. In front of this is the pre-SMA. This part here is the dorsal premotor area. And this omega region that you identify very nicely on MRI or also when you open the brain, this is the hand motor activation area of the precentral gyrus. Then here you have some craniometric points which also help you guide to find the location of the lesion. So here you see where the superior frontal sulcus is meeting the precentral gyrus. It is 1.5 centimeter posterior and 3 centimeter lateral to the bregma. This is the region where the parieto-occipital arcus can be found. On the medial surface, you can see that the foramen of Monro corresponds here to the coronal suture. Posterior to that is the paracentral lobule, which connects the pre and the postcentral gyri posteriorly. This is the precuneus. This is the cingulate gyrus. And this is, of course, part of the SMA region on the middle aspect of the hemisphere. The part where the middle frontal gyrus connects with the precentral gyrus is the frontal eye field, again important for the visual stream. And so these are some important cortical areas in the frontal lobe that we should all be aware of. And then we go into the white fiber network. So all this time we have looked at white fibers as association fibers, commissural fibers, projection fibers. But as neurosurgeons, we should look at them as how they are going to come in our way. So we look at them in the direction that they run and at the depth that they will lie. So if you understand and what structures they are related to. So if you look at white fibers in this perspective, you will get a three-dimensional architecture of the brain of this white fiber system. So in this paper, what we did is we identified the white fibers that will come underneath each gyrus. So if you look at the superior frontal gyrus, these are the fiber bundles that will come. So we dissected the whole brain in that aspect, identifying which fiber bundles will come in the way. And then we classified the white fibers of the brain according to its direction and the depth. And we divided them into 5 parts. So there are 4 horizontal layers and 1 vertical layer. So this is the first one. This is that of the short arcuate fibers or the U fibers. It's the superficial layer. Then this blue one here is the middle layer, which is composed of the long association fibers like the cingulum, the SLF, the IFOF, the uncinate. They all come in this part. The red circle here are also association fibers, but these are the ones that are in close proximity to the ventricle. So like the fornix, the medial and lateral longitudinal striae, the striae terminalis, all of them will come in this group. The central group here, the green one, is the commissural fibers. They lie in the center of the brain between this vertical group of fibers. And the last one, this is the vertical group, are the corticospinal tracts and the thalamic radiations. So, and as they go on to form the corona radiata. So this is how we have classified the white fibers, and it actually enhances your understanding when you're operating on brain tumors to identify which fibers are lateral to the vertical group, which fibers are medial to the vertical group, and which will be a boundary which you cannot cross when you're operating. So let's look at all these fibers from a dissection perspective. So this is the lateral aspect of the hemisphere. This is the Sylvian fissure. This I told you earlier, this is the pars orbitalis, the pars triangularis, the pars opercularis. This region where the pre and the postcentral gyri meet, this is the subcentral gyrus, and it sits here on the planum temporal of the superior temporal gyrus, which is the Heschel's area, Heschel's gyrus. So the auditory area, if you want to look when you're operating and you recognize this subcentral gyrus, then you have to realize that your Heschel's gyrus is just underneath that. This dilatation in the Sylvian fissure is the anterior Sylvian point. This is the superior, middle, and inferior temporal gyri. And you can see that the Sylvian fissure goes on to end in the supramarginal gyrus, and the superior temporal sulcus goes on to end in the angular gyrus. Now I've removed the first layer. So I've removed the cortex from the surface and in the depths of the sulci. And you see the first layer of fibers, that is the short association fibers or the U fibers. So now this is how when you look at it from a lateral perspective, if this is a 7 Tesla MRI image, so you see how innumerable these connections of the short arcuate fibers are, and they actually connect lots of portions of the gyri to each other. And we have recently published this paper where we are studying the connections of the short arcuate fibers of the frontal lobe. And I'll show you in an image how many different fiber connections are there. So if you look at this, these are the short arcuate fibers. So these are the few fibers. So this is one gyrus, this is another gyrus. So this is, look at here, this is the sulcus here. So this is one gyrus, another gyrus. So these are U fibers connecting this gyrus to this gyrus. Okay. Then there are fibers that are connecting from the U fibers to the long association fibers here. So this is one connection. Then there are fibers within the gyrus that connect part of the gyrus to each other. You can see in this transverse bar. And also there are U fibers that connect one part of the gyrus to each other. So there are innumerable connections of these short arcuate fibers, and it's really fascinating to study the anatomy. So this is the image that you can see. So they're connected here in the depths of the sulci, and also they're connected here on the superficial part of the surface where they connect the gyri to each other. Now, once you remove this superficial layer, the first fiber bundles that you will see is this one here that is running from frontal to parietal. And this is the SLF. So the SLF2, or the lateral part of the SLF, as I like to call it, because it lies lateral to the corona radiata, connects the middle frontal gyrus to the supramarginal gyrus. And the SLF3 connects the inferior frontal gyrus all the way back to the angular gyrus. And this fiber bundle that is beneath the SLF here is the arcuate fasciculus. Now, this one here that you see is the short arcuate connection of the inferior frontal gyrus to the arcuate fasciculus. And this is, it's really fascinating to understand this anatomy. Then you can see the short arcuate connection. Now all the gray matter has been removed. You can see the SLF nicely. You can see the arcuate fasciculus coming down. This is the vertical component of the arcuate fasciculus. And these fibers going up are the fibers of the corona radiata. Now let's go further down and we'll see some more fibers. Now here you see I've removed some part of the SLF. You see vertical fibers that are going here that connect the region of the inferior frontal gyrus to the superior frontal gyrus. And these are the fibers of the frontal aslant tract. So now you can see them very nicely here. So these fibers that you see running up are that of the frontal aslant tract. This is a magnified view of the same. So now coming down from the lateral aspect, we have seen these two tracts which are important. So the SLF, the arcuate. Here you can see some portion of fibers that are going posteriorly. These are fibers of the middle longitudinal fasciculus. And more down here inferiorly, you will have the inferior longitudinal fasciculus. So let's go now to the region of the insula. So the insula is the fifth lobe of the brain, the hidden lobe, surrounded by this frontal, parietal, and temporal opercula. So when you open the opercula means curtains, and then you will see the insula. I'm sure Barish has already covered this insular anatomy, so I'm not going to go into the details. So these are the anterior and posterior insular gyri, and this is the central sulcus of the insula. Now, this is the relation of the insula to the central core of the brain. Again, I'm sure he must have covered it, so we can go fast on this. Now, let's look at the white fiber anatomy of the insula. So here you see in this image, I've removed the insular gyri. Here you see the SLF. Here you see the arcuate fasciculus. Here you see fibers that are running posteriorly to the parietal lobe. That is the middle longitudinal fasciculus. And more inferiorly, you see fibers that are running here. This is the inferior longitudinal fasciculus. So now after removing the insular gyri, the first structure that comes into view is the extreme capsule. So what is the extreme capsule? Extreme capsule consists of claustrocortical fibers that connect the insula to the cortex. So these are how the insula connects to the higher centers. Once you remove the extreme capsule, you start seeing the external capsule. The external capsule has two parts. So this is the ventral external capsule and this is the dorsal external capsule. So the dorsal external capsule runs up here, joins fibers of the internal capsule beneath the arcuate, and goes on to form the corona radiata. And the ventral part of the external capsule has two major fiber bundles. This one that turns anteriorly and looks like a hook, that is the uncinate fasciculus, and this one that turns posteriorly and goes all the way posteriorly to the occipital lobe is the IFOF, inferior fronto-occipital fasciculus. So now you see the relation here. These are the U fibers, so the superficial group. This is the middle group, which is the SLF and the arcuate. These are also part of the middle group, the IFOF, the uncinate. And then here you start seeing some gray matter. Now I'm going to lift the arcuate fasciculus. And what do you see here? This whole bunch of fibers that you see here is part of the sagittal stratum. So let's look at them again. So this is the uncinate, this is the IFOF. This fiber bundle down here is the ILF. The MLF I've already removed. So this sagittal stratum has fibers of the arcuate, not arcuate, the MLF, the arcuate is lifted up. So the MLF, the IFOF, the fibers of the anterior commissure, fibers of the optic radiations, and fibers of the tapetum. So this whole structure together is sagittal stratum. Now, coming back to the region of the insula, so here you can see that the optic radiations are going here. Now you see this relation. So this is the first layer, that is the external capsule. This is the putamen, and in the depth you will have the internal capsule. So you can classically see this appearance on specimens where you have the external capsule, then the gray matter of the putamen, and then the internal capsule. So it gives a very characteristic spoke and wheel appearance, as you can appreciate in this image. Now, once I remove the whole putamen, I will start seeing the internal capsule. So these are the parts of the internal capsule. And now here you can see that the putamen has been removed, the arcuate has been cut, and this is the optic radiations. The first layer of the IFOF has also been removed, and you can see the optic radiations going posteriorly. And now this is the whole image showing the parts of the internal capsule. So the anterior limb, the genu, the posterior limb, the retrolentiform part, and the sublentiform part, which is the Mayer's loop, and this is the whole internal capsule. So when you come from laterally, this is the vertical layer of fibers that will form your barrier. And then to proceed with the dissection, you come from the medial aspect. So now this is the medial aspect of the hemisphere. You already seen the cingulate gyrus, which goes all the way down here and joins the parahippocampal gyrus. Also, it is joined by the lingual gyrus, which also continues as the parahippocampal gyrus, as you can see in this image. So this is the cingulate gyrus joining here the parahippocampal gyrus. Also, the lingual gyrus joining here with the parahippocampal gyrus. Then we have seen the paracentral lobule, the precuneus. This is the cuneus. This is the parieto-occipital fissure, and this is the calcarine sulcus with the anterior and the posterior limbs. And this is the visual cortex, which lies on these limbs of the calcarine sulcus. Then you start dissecting medially. So this is the corpus callosum. And here you see that we have started dissecting in the region of the thalamus. So this is the fornix here. This is the columns of the fornix. This is the mammillary body. And you start seeing the structure here. That is the mammillothalamic tract. Now let's go further into this. Looking from this perspective, you see I have removed the gray matter of the cingulate gyrus, and you see this fiber bundle that is here, that is the cingulum, which curves all around the corpus callosum and comes here to end as the radiation of the cingulum. Then from the hippocampus here, fibers of the fornix and go around the choroid fissure. You see to very instantly, and these are very constant connection to the precuneus. There is another very constant connection. Now you can see here the radiation of the cingulum, and here again you can see the mammillothalamic tract as it is going up and ending here in the anterior nucleus of the thalamus. This is the fornix. This is the thalamus, and this region between the fornix and the thalamus, which curves all around with the ventricle, is the choroid fissure. So now you can see in this region the radiation of the cingulum as it is joining here. This is the hippocampus. This is the fimbria. This one you can see is the dentate gyrus. And the dentate gyrus actually curves here and goes above the corpus callosum as the subsplenial gyrus, and then continues as the inducium grecium and the medial and longitudinal striae. So actually, embryologically, the hippocampus was placed dorsally, and when the hemisphere turned, it got carried forward. some fibers were invaded by the corpus callosum and some remained on top of the corpus callosum. So this part is actually a part of the limbic system, the supracallosal part of the hippocampus, that is the inducium grecium and the lateral and medial striae. So now you can see the fornix as it is going up here, the body of the fornix, the columns of the fornix, the mammillary body, the mammillothalamic tract, the anterior nucleus of the thalamus. And then more as you go further, I've cut the corpus callosum and you will go into the anterior nucleus of anterior thalamic radiations. So this is the whole dissected Pappes circuit. As you will see now, I will show you the whole thing. So to see the anterior thalamic radiations, I have cut the corpus callosum and then I will lift this caudate head in one piece, and then you will be able to see these fibers that are fibers of the thalamic radiations. So when you come from medially, this is your medial barrier. So they are actually the internal capsule and thalamic radiations are intermingled with each other. If you see from laterally, you call it the circuit which begins here, the hippocampus, the fimbria, the fornix, the mammillary body, the mammillothalamic tract, the anterior nucleus of thalamus. Sorry, I got cut off. Can you see now?
No. Can you
you
share
can
again?
screen share again.
Okay, now?
Okay. Can continue.
Okay. Pappes circuit, as you can see, the hippocampus, the fimbria, the fornix, the mammillothalamic tract, the anterior nucleus of thalamus, the anterior thalamic radiations coming to the cingulum and ending back here in the region of the hippocampus. And this completes the whole Pappes circuit. And then we decided to dissect it outside. And this is another important component of the limbic system, the medial and lateral olfactory striae, which connects to both these structures to complete the limbic network. So if those who are interested can read this subject here. Now coming from the inferior aspect, so this is the uncus. The anterior segment of the uncus actually corresponds to the amygdala. The posterior segment of the uncus corresponds to the head of the hippocampus. This is the fusiform gyrus, and here you can see the parahippocampal gyrus that is running. Now you see the relation of the uncus to the cerebral peduncle and the posterior cerebral arteries in this region. So when you start dissecting from here, you remove the gray matter. The first fibers that you see here is the radiation of the cingulum. Once you remove this radiation of the cingulum, it is just lying on the ependyma of the temporal horn from the inferior aspect. Once you reflect this radiation of the cingulum and remove the ependyma, you will see the whole hippocampus. And here in the roof of the ventricle, you will see the amygdala. Once you reflect the hippocampus and choroid plexus down, you see fibers coming here from the lateral geniculate body, curving and going in the lateral part of the temporal horn. And these are actually fibers of the Mayer's loop as they are turning to form the lateral part of the wall of the temporal horn. So here, this is the Mayer's loop, and this is from the lateral perspective. You see these fibers that are curving forward anteriorly and then going posteriorly to form the optic radiations. So this is part of the IFOF. These are fibers of the anterior commissure, and the whole thing together forms the sagittal stratum. So what is the significance of this? So if you realize here, this is the hippocampus in the temporal horn. So there is a portion here in the anterior aspect of the temporal horn, which is devoid of any fibers. So here, this Mayer's loop and the IFOF is in the roof, and only in the posterior part, it comes in the lateral wall of the temporal horn. So if you enter the temporal horn in this region, you will not cause any damage to the optic radiations. And this is important when you are performing amygdala hippocampectomy. And this approach has been used by us for many, many years. It was described by Professor Goel. And then we actually go ahead through the middle temporal gyrus, enter the temporal horn in this region, and then remove this whole thing in an en bloc fashion. So the neocortex with the amygdala, hippocampus, and the tail, and the whole thing in one en bloc fashion. And this is our paper on the subject. Here you can see this is the area that is safe to enter. Now there are other limbic circuits that connect that form the limbic network. So Here you have the supracallosal circuit, which I showed you, the Pape circuit, then stria terminalis, as Barish was saying. So that is the dorsal amygdalofugal pathway, which goes all the way from the amygdala and connects to the septal region. And then there is a ventral amygdalofugal pathway, which connects on the inferior aspect of the brain. And this is a model of the limbic networks that you can see. So here you see the fornix with the mammillary bodies. Here you see this one here that is depicted is the stria terminalis. These are the medial and lateral olfactory striae, how they connect to the entorhinal area. And then there is one dentate gyrus which goes above and forms the supracallosal circuit and connects here to the septal nuclei in this region. Lastly, coming to the commissural fibers. So this is the corpus callosum. This is another fascinating structure, and those who are interested can read this paper. The corpus callosum actually connects each part of one hemisphere to the other hemisphere, and it appeared in placental mammals. Before placental mammals, there was no corpus callosum. There was only anterior commissure, which carried all the information. The corpus callosum came into picture because we needed faster conduction times, faster reaction times. So you needed something that was, easy and shorter than the anterior commissure, and that is how the corpus callosum came into play. So based on this anatomy, we have described the corpus callosum as having dorsal callosal radiations which curve superiorly. This is, of course, the forceps minor or the anterior callosal radiations. This is the forceps major or the posterior callosal radiations. And then there are radiations of the corpus callosum that turn inferiorly. So this one is the tapetum, or the ventral posterior callosal radiation. And this is the ventral anterior callosal radiation, which connect the basal ganglia of each hemisphere to the other. So if you actually go to see, the corpus callosum completely envelopes the ventricle in all its radiations. And these are some important points. So when you make a callosotomy, when you're taking it as an access to the ventricle, you should always perform a transverse callosotomy, because then you will splay the fibers instead of incising them. And these are the safe areas where you can perform the callosotomy. When you're doing epilepsy surgery, you have to disconnect this whole thing. Otherwise, your results will not be good. And this region is where the motor area of one side is connected to the other motor area of the other side. And you avoid the callosotomy in this region. Coming to the anterior commissure, it starts here in the basal forebrain region. As you can see here, this is the beginning of the anterior commissure. It has two limbs, the frontal limb that goes on to connect this olfactory region, and the temporal limb which goes on posteriorly. So this is the bicycle handlebar appearance of the anterior commissure that you can see here. And this is its relation. So we had seen from the lateral side. So this is the IFOF, this is the anterior commissure, and this is the Mayer's loop. All of them join to this at this point to form the sagittal stratum. And the anterior commissure actually hugs the temporal horn. So, both the sides, the anterior commissure will go on and hug the temporal horn on the lateral aspect and take it in all its fibers. So this is the region of the substantia innominata and the basal nucleus of Maynard. And this is the anterior commissure fibers as it is going to hug the temporal horn. So again, from the lateral aspect, the IFOF, the anterior commissure, and the Mayer's loop. The next commissural fiber is the hippocampal commissure, which connects the two fornices to each other. It lies just beneath the splenium. It is also known as the saltarium. Here you can see both the hippocampi of both the ventricles coming here and joining in forming the fornices. More posteriorly, you will have the habenular commissure and the posterior commissure, which forms the leaf of the pineal gland. This is, of course, the massa intermedia, and this is not a true commissure. It just connects the two thalami to each other. So I think we can end my lecture here. And this is the applications of white fiber dissection, which maybe we can cover on another time. Thank you very much.
Thank you, Abhidha. Polish and Abhidha summarize all white matter tracks and deep brain nuclear and the basal ganglia. Is there any comments or questions they can answer? Comments from the audience? I think there's some of audience thanks, sending their congratulations. And also, I want to share my screen to show, maybe, if I can.
I think we have here a comment or question from Marwan Al-Asadi. He said, can you tell us ascending arousal system and its components, bundles, tracts, arrangements, and connects relationship to skull diameters? I don't.
It's a very complex system,
Yeah.
and not we
This
know
need a
many
lecture.
components of it.
That's
Yeah, it's a lecture for this. So a lot of components in the brainstem and the thalamus and in the frontal lobes that all come down and make that whole system.
okay. I think there is a. If anyone of the audience has any questions, please you can even talk directly, or you can write in the chat. They will ask our speakers about it. And regarding the upload to YouTube, it will be, it's already live on YouTube, so the lecture are already present. And after editing, maybe less than 24 hours, will be edited and ready on YouTube channel. Dr. Abuzer, do you have any comments?
Yes, I want to share my screen and share some of our articles the audience will find. Also, Barış explained whole anatomy of the basal ganglia, and also you can find the information from his article. We recently published 3D of all methods and the deep brain nuclei. Also, you can reach from the article these 3D models with labels and also videos. I only want to share this information with the audience. I want to thank again Barış and Abhidha. Also, it's the talent to perform these white method actions, but the more important thing is to explain and to present this work. You are a very great lecturer. Thanks again. Join with us and explain all these. I think we can close the session. Dr. Ahmet.
Yes, Doctor. I think if there is no any more questions or any comments, we can conclude this session. And thank you, Dr. Baris, and thank you, Dr. Abhidha, for this very nice information and very nice lectures. And thank you also, Dr. Abuzer, for your continuous support to our educational courses. You and Dr. Saman Sharif, and also Dr. Abhidha and Dr. Baris are regular speakers in our program. And we all enjoy their presentations very, very much. Thank you, everyone. And thank you all.
Thank
and
you.
by this,
See you
Thank you.
next time.
thank
Yeah,
you.
see
By
you.
this, we
Bye.
can conclude our fifth session, and see you all next week, inshallah. So goodbye, everyone, and thank you.
Goodbye.
Bye bye.